Hi, I'm Asha. Thank you for listening to my presentation today. So the topic that I chose for my literature review is in individuals with small intestinal bacteria overgrowth, does supplementation of probiotics of multistrains improve gastrointestinal discomfort? So to date, no current literature review has considered probiotics use in alleviating the gastrointestinal discomfort in patients with SIBO. So this literature review provides clinical relevance for complementary medicine practitioners on specific strains and dosages, as well as the safety profile of probiotics to use with clients with SIBO. So my rationale for this review was the main point that gastrointestinal discomfort, including bloating, cramping, nausea, diarrhea, constipation, vomiting, can be extremely debilitating for individuals with SIBO, and is a point of interest for complementary practitioners in their clients' treatment plans. So beneficial bacteria mechanistically could encourage homeostasis, which is something that we already know that can encourage homeostasis of the microbiome, but we're specifically looking at it for the small intestinal microbiome. And considering the safety and efficacy of probiotics is really important too, if you're considering it for treatments with your client with SIBO, as well as evaluating its safety alongside antibiotic therapy, if they're also using that, which some of the studies use as their control. So my search method for this literature review, 38 articles were chosen from CINHL and PubMed. The studies were limited to placebo-controlled trials only. And for the review, the following information was extracted from the article. So it included the author, its year of publication, the duration of the study, the design, exclusions of the population group, and diagnostics for SIBO. So for all these studies, they used the hydrogen methane breath test. Intervention, placebo, outcome measures, and results were also collected. So all qualitative outcome measures were used for the studies. So this included questionnaires such as the OM questionnaire, NIH PROM, IBS symptom severity score, IBS quality of life score, and they were the main ones. And then the internal validity was assessed using the critical appraisal skills program checklist for the random controlled trial. And this was applied to appraise the quality of the evidence overall. So my evaluation of the literature, I found whilst no studies in the review were statistically significant to eradicate SIBO, for the intended purpose of this review, improvements of digestive symptoms in the patients of SIBO were statistically significant with probiotic supplementation. So Garcia et al. In 2019 that showed 22% improvements in GIT symptoms. However, the results were inferior to metronidazole antibiotic therapy, as well as combined therapy. Levontogiannis in 2019 and Ringel and his colleagues in 2011 demonstrated efficacy with multi-strain probiotics, including Saccharomyces boulardii, VBN lactis, BB12, as well as LB plantarum. Gabrietti et al. In 2019 had statistically significant results for 200 milligrams of Bacillus clausei, which was just as effective as the antibiotic therapy. And Ringel et al. In 2011 conducted a double-blinding study. However, the other studies may have been subject to performance bias as they were open trials. All studies were limited due to their small sample size, unfortunately. And due to the prevalence of SIBO high in women, there was a slight gender bias towards the female population. And also, one of the studies recruited only from a single centre, limiting the cross-sectional population that was able to be applied to the study. So overall, this literature review does provide evidence that combination probiotic supplementation from 3 to 6 weeks may improve patient reported digestive discomfort in those diagnosed with SIBO via breath test, Whilst improvements for digestive symptoms were statistically significant, further research does need to be conducted for the use of probiotics as a baseline therapy, such as antibiotics has already been used. And further research needs to be conducted comparing the two, as there was mixed results. Supplementation overall has a really high safety profile. One limitation was the small population sizes and the potential reporting bias in some of the studies. So overall, basically my results showed that it's a really safe treatment option. Further research needs to be done to see if we can use probiotic therapy as a baseline treatment, but alongside antibiotics, the safety profile is really high, and it's a low risk treatment option that could potentially improve gastrointestinal discomfort for those suffering with SIBO. Thank you for listening to my presentation. Enjoy.